Welcome to PatientX Pulse, where we're making the heartbeat of healthcare marketing stronger, one episode at a time. Join us on this journey as we pulse through the veins of healthcare marketing, delivering insights, strategies, and results that matter for patient experience.
I'm here today with Michael Winkleman, the CEO and founder of PatientX, healthcare marketing that delivers more. Michael, thank you so much for joining us today. And I wanted to learn more about the origins of PatientX, how it all began and started about 12, 15 years ago.
Yeah. Well, technically 17 years ago, which
goodness.
Really ages me. But yeah, we started out just as your traditional marketing company, offering websites, branding, social media management. And we have at that time, we had several different facilities that we were working with and B2B companies that were in healthcare. The amazing thing about it is I saw so much compassion and so much, inspiring moments, both in the surgery rooms, behind the scenes, and then also from the patient's perspective, I saw a lot of good as well. At the same time, I saw, a lot of confusion when it came to communication from the physician to the patient or the patient to the physician. And it just really got me thinking there's got to be more. There's got to be a good way to get them to be able to communicate well and be for the physicians or the surgeons to be able to do the amazing work that they do, while the patient feels like they're really getting the best attention, the best care that they can get as well. At the same time, what really inspired that was some of the negative stuff that I saw as well. Some of the things that I saw from the backside, from the front desk, and the different processes and the way that they were handling billing and how they were, delivering communication and resources to patients. And then I also saw in the surgery room, some different, culture things that, really could use some tender loving care. So then on the other side is, during the same time, I really think that it was a divine thing of where this is where we should go, because my mother was going through some very difficult times with her heart, and at the time we thought it was just maybe she was getting tired from so many different things, and she kept going to the doctor and everything like that. She did a ton of research online, and when Dr. Google gets involved, it creates a lot of fear, and there wasn't a lot of great resources that really could help her pinpoint what her issues may be. So she went to the doctor, tirelessly, like over and over again, and it really came to the point where they were like, well, I think it's all in your head. And my mom was very energetic. She was a go-getter. I mean, like she could outwork most people, and I can remember her being up till 4:00 in the morning, working, doing crafts, cooking, whatever, it was just, she was amazing from that perspective. And then all of a sudden we saw her hit this wall, kind of a sudden wall, and we were scared. And, it really got us thinking, like, what's going on here? Because this is not normal for our mom, because we see her, we know her on a daily basis. So, we finally got her to a doctor that, did the correct, gave her the correct diagnosis through, doing MRIs and CAT scans and everything else. And come to find out, she had a hole in her valve. So that's what was causing her to have all these problems, slowing her down. So once we actually figured that out, then she was able to get the care that she needed through many different channels. She then ended up going to a facility that was 4 hours away from where they were to be able to get the care that she wanted. And she did, she found where she wanted to go through like Google searches and looking at reviews and everything like that. So, that really made me feel proud about what we were doing from a marketing perspective. But then it started making me think, where's the disconnect, with the different levels of care? So taking that situation, a situation that I had with my dad as well. And I'll tell you that story too, because I think it's important that we had this same kind of thing happen to another family member within, a small span of time. But he went in, tons of, having some pain and stuff in his side, went to the emergency room. And basically the ER doctor told him, I think you may have pancreatic cancer. Which you hear that word, you're automatically, fearful.
Sentence.
Right. And the ER doctor gave my mom a planning for death brochure, and all these brochures on cancer and what to expect and dealing with grief and everything else. Not something on the possibilities that it could be pancreatic cancer, and this is, the symptoms and everything like that. It was automatically like, here's your death sentence, here's your brochure. I'm like, okay, there's a problem in communication here. And no fault necessarily possibly of the team that was trying to take care of my dad, but it goes from the top up. Top down, right? So leadership has to have, a way to communicate and train people to really provide that healing spirit that I know that all these individuals really have. So it really got me thinking, further into like, how do we make a difference? How do we change the lives of patients at the same time helping physicians do what they are so passionate about doing? So taking all of those things, I started looking at different, data sources and doing a lot of research and everything. And what I really started to, what came out of that whole process was operations is truly the first tool in marketing. It's a different way of thinking, but it's truly the first tool in marketing. So what do I mean by that? So you got to have your operations team and your marketing team working together. Yes, we have the marketing tools that that we measure in our PatientX score, like the website health, brand reputation. But what's not really in there? Patient surveys, patient satisfaction, the culture. Marketing is not involved with a lot of the culture decisions that are happening within most of these facilities. And then all of those things really develop into what people perceive your brand being. So taking those pillars, reputation, branding, patient satisfaction, online reputation, and then another one, referral network. Because that was another problem that my mom ran into was, she had to pick up the phone. She had to take care of the situation and find her referring, where is she going to go outside of that facility? Because the facility that she was going to was not providing the type of care that she wanted. And you look at their reviews, they don't have great reviews. So she went to a place that had a great brand, great reputation, good referral network, and great patient satisfaction. And the care and the difference was really made. And they will drive 4 hours to go see these docs on the other side of the state just because of the quality of care.
4 hours.
4 hours.
Wow.
But, and that's pretty common now. I think the study that we looked at the other day was 60% of people have no problem driving over an hour and a half to find a different provider if they think it's going to be better care. And after COVID, not everyone, but the majority of people know they have a choice. So that's why they're looking online. That's why they're looking at reviews. Another stat that we looked at the other day was 80% of people make their decision of where they're going to go online. So, and that's the first thing they see is your brand, your website. So that's why all of those pillars are key things in what we are doing. But you can also see why those are the things that we have in our pillars because of the data, the experiences that we've had, both behind the scenes and from a patient perspective, and even from the information that's shared from doctors with us. So that's kind of how it all started.
Wow, what an amazing story. And just to make sure that I'm hearing you correctly, and thank you for sharing the story with your mom and your dad. But you.
Oh, let me add here. Okay. So he went to this ER, and I told you about the communication issue, right? Well, then they went to 4 hours away. Okay, this original problem happened in the same hospital that my mom was at. So my dad goes to this other place, and they do a biopsy. My dad's, getting ready, preparing, giving away all of his stuff. We go 4 hours away. They do the surgery, and guess what?
No cancer.
No cancer. He has a tumor or a cyst.
It's benign.
So yes, he had some lesions and stuff like that, and they have to, consistently see him on a yearly basis. But my dad's still here. My mom's still here. Great spirits and everything, and just the different level of care and the attention to details, communication, process, just the experience that they had online with this facility as well made all of the difference. So
wow, and it does go a long way. And unfortunately, like many of us, it takes a personal experience that we have to go through, or even with our family, to where you said there has to be more to this.
Yep.
And you literally created more by identifying the 5 strengths with the pillars. So website health, brand health, cultural health, the patient experience, because of the experience that you witnessed firsthand from what your parents are going through, but more importantly, you also had behind the scenes access and visibility to what was going on. And that shaped the entire PatientX, the patient experience,
exactly.
the healthcare marketing that delivers more.
And we did photos, we did, multiple different things that we would consider traditional marketing tactics within facilities. And that reached probably 500 plus different facilities. So when I say that I have experience from the actual operational side, the back side of what's going on within a facility, it's a good number of, facilities that we were in, being able to witness all this. Like I said, majority good, some bad. But the number one thing that I know about every single one of them, they wanted to improve. They just didn't know how. And that was the thing, So it's like, how do we help them? Because I have a lot of great friends that are administrators and physicians and everything like that. The best people. But how they struggle with sometimes, that they've told me, is how to communicate. How, like when they're still focused on saving lives, the bottom line. How do they make it so that their culture is inspiring, and just they want their team to come to work every day and be inspired? And even when they have a negative situation, how do they control it positively? And so that's,
So are there any challenges, because a lot of people, they look at marketing or social media and they think, oh, it's just a website or it's just social media. So when you talk about bottom line, and this necessity and the need for having an agency like PatientX,
right.
And what would you say to a purchaser or an administrator that says, well, we're getting cut with readmission reductions. We also have CMS is cutting down our reimbursements on patients. We can't afford to hire an agency to help us with marketing.
Right.
How would we be able to communicate to that audience where you have a challenge and there has to be a change, there has to be a turning point in what you've been traditionally doing, because there is an impact and a difference that we can make. So how would someone listening right now that's like, how is this doesn't apply to me, I don't have the money, or we don't have the problem? Well,
I shouldn't say the biggest problem. One of the problems that I've witnessed in healthcare is, especially like smaller facilities and stuff like that, they do struggle. But what you'll notice too is they invest in the wrong things sometimes when it comes to marketing. For example, we have a lot of people that will come to us and say, I need a website, I need more patients, I need a website. And we're like, whoa, slow down. Because a website can be very expensive, but is that really what's going to help you reach your goal? So that's why we created the PatientX score. So it's a self-assessment that they can go through with those 5 pillars to really evaluate where is the actual problem. And then it gives us an insight to the way that they're feeling. They can take it, the administrator, the physician, they can share it with their team, have each one of them take it, so you get different, perspectives. And then from there, we create a plan. And we may say, you might have come to us for a website or like a new logo or something like that, but you had the goal to increase your patient acquisition. So is the website really going to be the thing for you? Great, you got a beautiful website now, okay? But the reason you're losing all of your patients is because your culture, or maybe it's your online reviews. You know what I mean? So that's the difference, is we take it from that perspective. We create, cost-effective solutions, and we can create a strategy. It may not be where you have all of this done within 1 month, 6 months. This could be a 3-year plan to get you to a place where you're getting better patient satisfaction scores, better reviews. Your brand is top-notch and your team is 100% behind you. But not everything is free. So not if you want something quality, but it is doable. It is achievable. Everybody has a budget, because if you're losing money, you're not going to make money,
right?
Is the thing. But the other thing is, if you're losing patients, you're not doing what you went into this for in the first place, which was to save lives or improve people's lives. And, that's what you have to take into consideration too. So.
And it's interesting. I've never heard of a marketing agency help a facility or a surgery center help develop a strategic plan and a strategy, yet alone, helping them with all these other areas.
Right.
So that's unique within itself, because, most companies, if you go in and you hire a consultant to help you develop a strategy, you're looking at anywhere between $20,000 to $30,000, $40,000.
Right.
And that's just a light assessment. It's nothing as in-depth as and thorough as the PatientX score self-assessment, and being able to identify those key areas. So
Exactly. But I think that's the thing for us is, as our vision states, it's to create a transformational experience. I mean, that's what we wake up every morning to do. And that's what we ask each other every day. What did you do today that really created a difference and transformed the experience in someone's life? So the thing for us is, we are a profit company, but what we do is we help them. We provide solutions, not just, buy my website. We're not traditional, and I don't want to be traditional. Profit comes, from success. And if our clients are successful, we are successful. That's why it's a partnership. So
that's a true partnership where there's reciprocity.
Right.
There's a benefit on both sides.
Absolutely.
Win-win.
Yep.
Yeah. Well, thank you so much for sharing and just learning about there has to be more.
Right.
More patients, more leads, more freedom.
Yep.
And more importantly, what happened with your mom and, with her heart, and how PatientX, we keep patients at the heart of everything that we do.
Yep.
And how beautiful that story is, to know that she is still with us today, and
Yep.
that, both of your parents are. But imagine, so many people out there in the world, thousands and thousands of people who accepted that and
Right.
did not bother to educate themselves or to go further, or can't even drive the 4 hours.
Right.
But to be able to take a facility or, a surgery center, whatever, a physician's office, I mean, we do it all.
Right.
And to help create a transformational experience so that patients in their community aren't having to leave and go 4 hours away because the doctor or the ER didn't have good bedside manner, or
Right.
they didn't understand how to fully educate a patient with empathy and with compassion,
Right.
as if it were their own relative, rather than treating them like a number.
Right. Exactly.
So we need to get back to humanity with healthcare.
Exactly. And I mean, we do that in multiple ways too, if you really think about it. We talk a lot about the patient, but really if you think about where the heart of it all starts is with the physicians. And, like you've done workshops with, physicians on, physician burnout and everything. They are they're in our heart too, and that's part of it, right?
Absolutely.
So, it's the human experience. It's not just the patient experience, it's the human experience. We use the patient experience because that's the buzzword. And, that is the center of what we are doing it for, because our clients, that's the center of what they do it for too. So, yeah.
Amazing. So if there were one piece of advice or call to action for our listeners that may be intrigued about who we are and what we do, what would you say to them?
I would basically say that don't underestimate your potential. And if you feel like you do have a need to see, where you currently stand with your marketing, branding, and so forth, take the PatientX score, do a self-assessment. It's going to give you a grade of where you currently sit.
And
right?
it's free.
And it's free. And then the other thing is until we show you what it could cost or we have the conversation, the sky's the limit. I mean, that's free too. So, so don't say, no, I can't afford this until we actually give you a price.
Right.
So, but your patients can't afford bad marketing either, and bad culture and
bad experiences.
Bad experiences, right? So neither can they, because what they do every day is so important as well. So
absolutely.
Yep.
Well, thank you so much.
Yeah, absolutely, no problem.
PatientX, healthcare that delivers more.